In 2007, the Consumer Health Products Association voluntarily recalled over-the-counter cold medications for infants. Since that withdrawal, there has been a 50% reduction in cold medication-related ER visits by children under the age of 2. But of the visits that do occur, 2/3 were the result of kids consuming meds without adult supervision. Joining us this morning to talk about these results is pediatrician Elizabeth Hansen. Good morning, Dr. Hansen. Thanks for getting up with us.
Morning, Amy. Thanks for having me.
Good morning. Let's start by talking about why these medicines are so dangerous to young kids.
Right. So cough and cold medications historically been commonly used and marketed towards infants and children, but we've traditionally seen a number of adverse events related to their use, mostly because of unsupervised ingestion and overdosing, leading to sedation, neurologic sequelae, etc. And actually, there's also good evidence that they just don't help much with relieving the symptoms of the common cold.
Wow. So are you surprised at all by the results of this study?
Well, I think it shows some improvement, that definitely the message got out that under age 2, these medicines are not appropriate. But unfortunately, age 2 to 12, there still was the same number of ER visits for adverse events related to cough and cold medicines before and after the 2007 industry withdrawal. So some more education needs to be done, because really under age 6, these medicines probably don't offer a lot of benefit and are still dangerous for children. And the most up-to-date recommendation from the FDA is that under age 4, they really should not be used.
All right. So going back to these accidental overdoses, we've talked about education. What about manufacturers? What role do they play in this? I mean, should they be making these packages harder to open, or are they doing the best that they can?
Absolutely. They play a huge role, both in changing packaging so that it's more difficult to access the medicine for a child. So dosing is more easily and obviously outlined on the packaging, because the other thing that can happen is that parents can accidentally overdose a liquid medication commonly. And also marketing. I think it's up their responsibility to adjust their marketing practices so that they're aiming their marketing at age-appropriate groups.
Okay. You mentioned, too, I was surprised by this, that these drugs don't do a lot of good for young kids. All right. As a mom, the flu has been running through our house right now. How do you comfort your kid? What do you do to make them feel better if you can't give them these over-the-counter meds?
Right. It can be frustrating, and really it's back to basics, Amy. You know, running a warm vaporizer or cool mist in the bedroom, drinking plenty of fluids, using saline nasal drops to clear up their congestion, and even giving them a dose of honey prior to bedtime so that minimizes their cough overnight can help a lot.
Okay. And of course, give your pediatrician a call if you have any questions.
Absolutely.
All right, Dr. Elizabeth Hansen of Gundersen Lutheran, thank you so much for joining us this morning. It is something that a lot of parents will be talking about over the next couple of months during cough and cold season. Thank you for your insight.
Thank you, Amy.
All right.